Structural racism is a combination of public policies, institutional practices, social forces and ideologies, and processes that generate and perpetuate inequities among races. Structural racism's impact go from not getting access to evidence-based treatment, to getting more institutional care and less outpatient care, to making it more likely that they would have an interaction with the police due to untreated mental disorders, and it affects access to care.
Just from the diagnosis, from your presentation, from treatment, and from the quality of care that Black patients get, all of them are affected by structural racism. A Black patient is more likely to be seen as suffering from a psychotic disorder when they are in fact suffering from a mood disorder.
There have been studies that show that Black and brown children are more likely to be prescribed antipsychotic medication than their similar-aged peers who are white.
It's been a national movement to look at structural racism in every organization, in every aspect of society. Dr. Jeff Geller appointed this task force to look at what we can do to make sure that we do not have structural racism within the APA now, and especially looking forward to the future.
The job includes providing education and resources about APA and psychiatry's history regarding structural racism, looking at the current impact of structural racism on mental health of our colleagues and our patients and their families, looking at achievable and actionable recommendations for change, and providing reports to the Board of Trustees.
Recommendations have been passed to the board and largely approved, and it will set forth a series of priorities that we'll be working on for years to come.
Change, if change is to occur, must account for the fellows, those in training. So it was important to have a separate work group for fellows. Ethics fellows develop a toolkit that answers ethical dilemmas that confront residents and fellows in their training.
Looking at how we train psychiatrists to be more sensitive to social determinants of health allows us to make a better informed diagnosis and to a more informed treatment plan.
It's an ongoing issue, and we need to continue to increase awareness of the importance to everyone about inclusiveness and diversity and equity in all of our activities.
People can just start off by looking at the Structural Racism Task Force website. There are wonderful a series of books to educate yourself, and looking within their own district branches or their areas to say, what kind of projects would we like to do? We've got podcasts out there, there are videos out there. So whatever they're interested in, take a piece of that and get started.
There will be a presidential town hall on structural racism to inform all of our members about the wonderful work that the task force has done and that we plan to continue doing within the American Psychiatric Association.
This is the first step. It's a fantastic first step, but it's only a first step, and there's more work to be done.